Okay, so you make sure you suction your patient before you do trach care. That way, you're not in the middle of trach care and the patient needs to be suctioned. Okay, so same thing, you knock, identify, greet, wash your hands. You're going into the patient's room to do trach care. Turn up that oxygen, so because you're going to have this off of them the whole time this time. So there's not going to be any putting it back on. So make sure you turn that oxygen up to give them some extra oxygen. Clean glove or regular gloves. I'm going to open up my area. And our nice little Olay we all love so much. That's going to come open in a minute. I take it out of the box. And onto the table. Now at this time, it's however you want to do it. I take mine out and lay them out like this. Some people just turn them up on the table. Okay. Turn your tray sideways. You are again going to have your sterile water or normal saline, whatever your facility uses. Make sure you palm the label, lip it if it's not a new bottle. Or on the far side first, and then this side. She's not coming today. And then peroxide. This is again per facility. You'll have to check with what the facility does. Not all facilities uses peroxide. Palm the label. If it's not a new bottle, check your date that it was opened, your expiration date. Palm the label. Lip it if it's not a new bottle. Pour. And set these to the side so you're in no danger of them getting in your sterile area. You can totally set them off the table if that's what you want to do. Okay, so now it's time for your sterile gloves. So if you want to go ahead and make your hand so you won't have to make one of your hands dirty right off the bat, you can go ahead and move this down. Weird sterile gloves. She didn't think so. I suggest getting sterile gloves. Don't use the sterile gloves that's in your kit unless they're in a package, because these are all messed up. Okay, so this is the contents of your package. There's cleaning gauze, your soft wick, you've got pipe cleaner, your brush, and some Q-tips. Okay, so the first thing we're going to do, this is going to become my dirty hand. I'm going to take the cannula out. You just turn, it comes out. I'm going to take it, and like that would be bad. Okay, so I'm laying it in there. I'm going to let it sit in there for a little bit, and I'm going to go ahead and get my Q-tips with my clean hand. I'm going to dip them down into the clean water, and I'm going to clean around my area using one in the front. That's now trash. One in the back. That's now trash. And if it's really crusty, you can use some of your gauze to even clean around that area by dipping it in here. Okay, so now that that's soaked some, you take your brush, go from dirtiest to cleanest, so you go in the end. But can you see it?
Yes.
And not over your sterile field. You can clean the outer. Now that's trash. And then you dip this into your sterile water. Grab your gauze, dry it, and then you grab your pipe cleaners. You can twist them together or not, and send them down through there to dry. Those are now dirty. Now, with this dry, you're ready. Do not touch the outside. You're ready to click that back in. You're done, except for putting your soft wick back on. Now you take your soft wick, move your gown down, you drop it, and then you use your tweezers. If they allow you to, they want to stick to it. To get your, and then you can apply oxygen back to the patient.